So with regard to this acceptance criteria, typically it's very strict and we don't waver from it much. We have to have exposure to the drug. You have to have taken Permanent or Prempro for at least the minimum amount of time. And for Prempro, the combination drug, it was 3 to 5 years, and for Premarin, which is estrogen alone, it's at least 10 years. And of course you have to have the correct injury, which is breast cancer, and the damages are from everything from the cost of the medical care, out-of-pocket expenses for the surgeries and things like that, as well as the scars and disfigurement from having to have a mastectomy or double mastectomy, or any of the processes that go along with the treatment in radiation or in chemotherapy. The science of this litigation is very important. That's part of this criteria when we talk about the minimum number of months or years that you have to be exposed to the drug. What we are really saying in this litigation is not that hormone replacement therapy causes cancer. The other side of this litigation, the pharmaceutical companies make a big deal out of the fact that all the doctors say they don't know what causes cancer. Well, we're not saying that we found the golden egg or the tunnel, or that we know something they don't know. That's not what we're saying. What we're saying in this litigation, and what is absolutely true, is that hormone replacement therapy interacts with cancerous cells that are in everyone's body. And without the estrogen and without the progestin that you find in Prempro, estrogen and progestin, or just estrogen alone, those cancerous cells wouldn't be growing the way they're growing, and they wouldn't be growing as fast and as furiously as they grow in a lot of the ladies who have breast cancer and have been treated for breast cancer likely would not have the problem. Again, we all have cancerous cells in our body. The question is do they start growing or proliferating to the point where they start overtaking healthy cells? And of course, we know a lot about what estrogen does to the body and how estrogen affects these cells. Estrogen has been known to be a carcinogen for a long, long time. Estrogen alone was prescribed for women who had not had a hysterectomy, and they started having cancer below the waist because of that. In order to stop that, they added the progestin to the estrogen and recommended the progestin and estrogen only for women who then had a hysterectomy. Well, they knew at that time it would cause and could cause the proliferation of these cells in the breast, and that's exactly what's happened. So when we look at this litigation and we review cases to determine if we can handle them or not, we have to find that the ladies took the drug, took it for the right amount of time, that there is a test that is done with any kind of surgery like this. It's called a pathology test. The pathology will tell us whether the tumor that was removed or the tumor that is suspected to be cancerous is hormone positive. That means that it has estrogen in the tumor. That means that it is absorbing the estrogen to grow. If it is estrogen positive, it's likely related to the hormone replacement therapy. If it is estrogen and progestin positive, it is assuredly related to the therapy. Now understand that as a woman reaches menopause, her ability to produce estrogen decreases. If she still has the female parts or ovaries that manufacture the estrogen, she may have a little estrogen in her body even as she's taking hormone replacement therapy. If she's taking estrogen only, or if she's taking no estrogen, she may have some estrogen in her body. But so she starts stopping producing the estrogen. And so there would not be any feeding of these tumors without the introduction of the hormone replacement therapy. When the estrogen outside the body and unnatural to the body is put into the body where it naturally shouldn't be, those tumors absorb it very quickly. And that is why we are certain when we have an estrogen positive tumor and a progestin positive tumor that it's related to the breast cancer. The progestin is the accelerant that is, or the fuel that's thrown onto the fire. The fire is the estrogen feeding the tumor. So if we have an estrogen and progestin receptor tumor, if that's what we find in your pathology, we absolutely know that yours is related to the hormone therapy. A big question and a common question that we hear is, how long will this take? There's nothing short about pharmaceutical litigation, especially when it's in an MDL, multi-district litigation court. Remember that there are thousands of cases that have to go through the system. It's really a two-part system, working first in the MDL court on the general liability issues before we can get to any specific or case-specific issues. And so the general liability part of these cases can take up to 2, 3, 4 years, and then working on the individual cases can take longer than that. Typically, we're looking at 2 to 4 years before these cases get to the point where the pharmaceutical company is ready to settle them. There are also in settlements usually some acceptance conditions, because you have an aggregate number of people or an aggregation of all of the potential claims in this settlement. A certain number will have to accept the settlement for the settlement to actually be funded or go through. I've never had one not funded, even if we didn't meet that number, but by and large, I've never had one not meet that number either. Because these take a long time, and because people generally want to get it over with by the time the settlement occurs, they accept the settlement. The settlement values are fair in this kind of litigation. Sometimes they're better than others. There are a lot of misconceptions because we hear a lot and see a lot on TV about the value or amount of verdicts or settlements. And without knowing the true facts of every single case, there's no way for a lawyer or much less a client to evaluate whether their settlement compares to another settlement. We do the best that we can to get a fair and just settlement for the clients and to start the litigation and end the litigation within a reasonable time. Now that goes without saying that no amount of money would reverse this process and make it so that you never had breast cancer or that you didn't lose your loved one. That's already happened. It's a matter of getting some redress. You're not going to get an apology from these companies. They really are not very sympathetic about it. They never admit that they've done any wrongdoing, and they pay the money to settle these cases with very strict confidentiality requirements, where you can't even go tell anyone but your accountant about the amount of the settlement. They try to keep you from even telling your family. So while there's not going to be any settlement, what our goal is to bring justice to not just the women we represent, but all women who have been affected by this drug and have suffered the breast cancer because the drug company just couldn't be honest with the ladies that were taking the product.